Hello, my name is Sherry Bailey. Today I am making this video about the assessment tool for my change project. In order to know that my change project is being implemented correctly, it's necessary to have a way to assess the effectiveness of the project. I do believe that with this specific project, the best assessment tool you can use are the statistics. In the labor and delivery world, postpartum hemorrhage is a problem if not recognized early enough. According to A1, I think they say that 54 to 93% of maternal hemorrhage-related deaths can be prevented with improved clinical response. That's a pretty significant number, so we really want to make sure that these postpartum hemorrhage risk assessment tools are being utilized with every single patient. The first thing that I will have to do is to assess the charts. To look at the total number of deliveries you have in a month. I think that's the best timeline to use if you go month by month, because you can look at the total number of deliveries in a month, and then the nurses will be turning in the postpartum hemorrhage risk assessment worksheet. There's going to be a worksheet that has the postpartum hemorrhage risk assessment on it and the QBL worksheet on the back. They'll turn that in. So then I will go through and put the numbers of deliveries in a month onto an Excel spreadsheet, and I did attach the spreadsheet to my submission. And then I will look through the worksheets and I will put the total number of risk assessment worksheets that were turned in, and then I'll get the percentage of risk assessments done for the total number of deliveries. If that number of risk assessments is less than 100, then it's necessary to ask the nurses why the risk assessments weren't being done and provide education and coaching if necessary. If there's a good reason, then we can document that, but still, the risk assessment honestly is not one that should be skipped ever, because there's not really a reason to skip it. So it's just important to make sure that you do document why it's being done, and then to make sure to go back and educate. Being that we're also implementing the QBL worksheet as well, we'll also have to assess for that too. QBL will never be exact. However, it is more accurate to do some measurement than rely solely on visual estimates. They used to just rely on EBL. It's proven that it's not nearly as accurate as quantitative blood loss. So this is why we want to do the QBL to the best of our ability. We will put the QBL statistics on the same spreadsheet that the postpartum hemorrhage risk assessment numbers are on. So there's going to be about 5 columns. And so then the next column would be the QBL column. We'll look at the total number of QBLs done after every delivery. If that percentage is less than 100%, we'll also have to go back and figure out whose patient it was, find out why it wasn't done. If there is a good reason, then we can document the reason as to why it wasn't done. But there is still a way, there's always a way to do some type of QBL, whether it's postpartum, maybe you couldn't do the delivery QBL, but postpartum you were able to weigh her pads and, all that other stuff. You can still do it. It just might not be as accurate as it could be. But either way, you do still need to give that education and make sure that it's documented as to why it wasn't done. Even though there are certain instances where QBL can't be utilized, it shouldn't happen very often. You want to make sure that it's being done as much as possible. And like I said, if it's not, then you definitely need to go back and coach people and, find out what's going on, why it's not happening. However, like I said, the postpartum hemorrhage tool, really, there's not a reason I can think of as to why that wouldn't be done. You should always have that done. If it was a precipitous delivery, you still do it postpartum, after the baby's born, because I think even being a precipitous delivery can increase their risk of hemorrhage. So it's really important to make sure that you're still doing it even after the baby's born. If it's not being done, we need to remind our nurses and staff why these tools are being used, that they're in the best interest of the patient, and that's why we're utilizing them.